Good morning. Welcome to the Women in Buddhism conference hosted by Seattle Betsuine. My name is Sharon Sue, and I'm a professor of Buddhism at Seattle University, and I am absolutely delighted and grateful to be here, offering today a mini lecture and practice in healing through mindfulness and yoga. And I cannot think of a better time to be practicing mindfulness and yoga, especially because we're living in such a difficult time right now with the pandemic, as well as the heightened racism against people of color. And so what I'd like to do today is begin with an overview of trauma, what it is, and some of the ways that mindfulness and yoga practice can help us begin to understand where trauma comes from, understand how it manifests in the body, and also learn different techniques for handling trauma and the triggers that trauma can sometimes bring up. Now, this is by no means an exhaustive introduction to mindfulness and trauma. We have 30 minutes. And so for the sake of brevity, I'm going to be referencing a PowerPoint presentation as well as offering some practices that we can do together. So I will begin by opening up my PowerPoint. So I'm going to be sharing my screen right now, and I will share with you some of the definitional understandings of trauma. But let me begin with what I like to call a transition meditation. Now, our lives are so incredibly busy, and we go from thing to thing to thing, to event to event to event, and we're so busy that we often forget how we got here in the first place. And so as a way of honoring the effort that you've taken to be here with us today, let's take a few moments. So I'll invite you first to take a nice gentle dignity with your spine. So go ahead and just maybe roll your shoulders all the way up, back and around, and melt them down your back. So when we're practicing meditation, we want to have a elongated spine, but nothing too rigid. So go ahead and find that balanced spot for yourself. And when you're ready, I'll invite you, if it feels all right, to go ahead and close your eyes. Otherwise, you can take a gentle gaze about a foot in front of you. Now, on your in-breath, I'll invite you to draw your awareness and your attention to your feet, noticing the sensation of your feet as they touch the floor, as they feel the carpet. Just notice whatever sensation there is. Perhaps you notice warmth or tingling, some heat. Maybe you notice the texture of your sock. Whatever it is, just notice it without judging it or without creating a story about it. Just notice the physical sensations. On your next in-breath, I'll invite you to draw your attention from your feet all the way up to the backs of your legs, noticing where your body makes contact with the surface of the chair, maybe your cushion. And notice the physical sensations there. Maybe you notice some pressure, some hardness, maybe tingling. Whatever it is, just notice it without judgment. On your next in-breath, I'll invite you to draw your attention to wherever it is in your body that you feel your breath. Maybe it is in the rise and fall of your rib cage. Maybe it's the rise and fall of your chest. Or perhaps even you feel the in-breath as it tickles your nostrils. Just notice your breath. And notice with kind awareness. If you find that your mind has wandered off into thinking, don't worry about it. That's what minds do. So as soon as you notice your mind wandering off into thinking, see if you can draw your attention back to the sensation of breath. And we'll just settle here for a few more moments. And we'll end this transition meditation in just a moment. So when you're ready, taking a deeper breath in through your nose. On your exhale, go ahead and blink your eyes open if you had them closed. And feel free to make any movement or stretches that you need. Wonderful. Thank you so much for taking the time to practice that transition meditation. I find it very helpful to give us some pause during the day. So let me begin with my presentation today. My presentation is, of course, on healing trauma through mindfulness and yoga. So I really want to express my gratitude for all of you being here today. Now, I want to begin with this quote. This is such an important understanding of mindfulness that I have found to be incredibly valuable in all the work that I do. And so this is a quote from one of my meditation teachers. Awareness leads to choice, and choice leads to freedom. And right now, many of us are feeling a little oppressed these days. And as the feminist thinker Bell Hooks notes, being oppressed means the absence of choice. And if oppression is the absence of choice, and awareness is what gives us choice, then awareness is also directly connected to the experience of freedom in our bodies. And so awareness is something that we can cultivate through mindful practices such as breathing and yoga. And yoga really is a breath practice. It's about integrating our body, our mind, and our speech into the present. I also like to think about mindfulness and awareness as an opportunity for us to move from a kind of knee-jerk reaction to events as they're taking place to a more discerning response, a more creative response, a more skillful response, and responsibility. So think back to that last time you read something on the internet that all of a sudden just really got you upset and angry. And so those are the times where it's actually quite helpful to step back a little bit and take a breath and begin to realize that something might be happening outside of you, but we don't need to react to everything right away. It's okay to take a pause. And so these practices of mindfulness will allow us to do just that. So it's really important for us to have an understanding of what trauma is. And I'm going to begin with one of my favorite neuroscientists, Bessel van der Kolk, who wrote The Body Keeps the Score. And he was quite revolutionary in his work because he really advocated for the practice of yoga and mindfulness as a way of healing trauma. So van der Kolk writes, trauma is much more than a story about something that happened long ago. The emotions and physical sensations that were imprinted during the trauma are experienced not as memories, but as disruptive physical reactions in the present. In other words, our bodies store all of the past traumas that we have experienced. Some of these traumas we've experienced consciously, and some of them have been unconscious, Nonetheless, our bodies have always reacted to trauma, and the experience of that trauma is something that rests in our bodies. And so mindfulness and yoga is a way of learning how to dissipate some of the energy of trauma that gets lodged in our tissues. Van der Kolk also writes, neuroscience research shows that the only way we can change the way we feel is by becoming aware of our inner experience and learning to befriend what is going on inside of ourselves. Now, many times survivors of trauma have a really difficult time being in the body because the body can feel like an unsafe place. So mindfulness, meditation, and yoga can actually allow us to become much more familiar with what is going on inside our mind, heart, body complex and learn to befriend it instead of shutting down or perhaps acting out. But it does take practice. Now, the next slide I have here is very helpful in defining what trauma is. So, trauma is an event that is experienced that has lasting effects in our bodies. And many trauma specialists note that trauma is the absence of choice. It is something that happened to us that we had no choice about. Trauma is also a natural reaction to an unnatural experience or overwhelming experiences. And so in this regard, trauma is actually a survival response in the body. But sometimes the body gets quite hypervigilant or the brain gets quite hypervigilant and thinks that we're always in that state of danger, when in fact we might not be. So trauma, again, is that event for which we had no choice, and it is also considered to be any experience that overwhelms our ability to cope. Bessel van der Kolk notes in his book, for real change to take place, the body needs to learn that the danger has passed and to live in the reality of the present. Now, I can think of countless ways in which my body has reacted to things that actually aren't happening in the moment, but it's my response to an event that happened in the past that makes me think it's happening in the current moment. So I'll take, for example, my fear of snakes. I don't know when I developed a very unnatural fear of snakes. Maybe it was from my mother. But what I do know is that I could be happily watching TV and all of a sudden a picture of a snake can appear on the television and already my body begins to breathe more quickly, my heart rate raises, my hands get a little bit sweaty, and I basically want to run away. So that is a physiological response to a traumatic event that happened sometime in the past that I don't even remember, yet affects my body and my mind tremendously in the present moment. So mindfulness and yoga will actually help me to notice the differences between a real physical danger in the present versus my response to something that actually isn't happening. So these are things that the Buddha himself also taught over 2,600 years ago, and neuroscience has finally caught on. They might not agree with my assessment, but that's my assessment. Now, the question is, what are triggers? So a lot of people talk about triggers these days, and I think it's a word that is so valuable and important, but like many things can be overused in popular culture and therefore kind of lose its significance and importance. So a trigger is a physiological response outside of a survivor's control that reminds them of past traumas. So symptoms of trauma can actually lay dormant inside of our bodies, accumulating for years and sometimes decades. And then during a particularly stressful period, or as a result of another incident, these symptoms can appear without any warning whatsoever. And then our bodies go into traditionally fight, flight, freeze, or shutdown mode. So, what are some of the common symptoms of trauma and their triggers? The first one is dysregulated breathing. The next might be throat constriction, So if you think about the last time that you were experiencing some stress and anxiety, you might have felt it in a tightness in your throat. There's also a lack of presence. So this might be where we kind of check out a little bit. Nervousness, GI issues, sweaty palms, which I mentioned before, heart palpitations, flashbacks, anxiety, insomnia, hypervigilance or heightened sensations. Maybe we feel a kind of clenched chest or clenched shoulders, a clenched jaw, heavy heart. A lot of people experience backache or headache, sometimes migraines. Of course, there's also a loss of sensation and tingling, and sometimes numbness, both physically and emotionally. And these triggers and symptoms are very real, and they live inside of our bodies. So a lot of times people think that trauma is an emotional response, but it's actually quite physical. Now, there are many different types of trauma. The first one is shock trauma, and this is usually a one-time event like a natural disaster or an accident. There is also what is known as cumulative trauma or complex trauma, and this occurs over time. There's a specific setting, maybe it's during childhood, if you were a survivor of abuse, child abuse, sexual abuse, incarceration, racism, domestic violence, maybe an abusive boss. There's also historical and intergenerational trauma, and this is experienced by entire communities, and it leaves emotional, psychological, and physical wounds, and these traumas change our DNA over the course of several generations. So examples of these, of course, include incarceration, slavery, genocide, forced relocation, poverty, as well as the destruction of cultural practices. And for many people of color, this is an experience that continues to live on in their bodies, but also is happening in the present moment. So in terms of trauma, there's usually what we like to call big T trauma. So this is a large scale event, as well as little t trauma, or what I like to call death by 1,000 paper cuts, such as microaggressions. And lately in the work of yoga and trauma-informed yoga, there's been a lot of attention paid to race-based trauma. And this is a very important thing for us to be exploring these days, especially given what's going on right now in our current climate. Now, why focus on trauma? Well, because we all have it. So studies in the West, in the US in particular, have shown that 70% of people experience at least one big T event in their lives. 30% of people experience 4 or more big T events. And the reality is that not everybody experiences PTSD or post-traumatic stress disorder and other forms of complex trauma, but 20% of people do. So there's a term called acute stress disorder, and this refers to traumatic symptoms that fade within about a month or so. So it's very common for people who've experienced a car accident that was not debilitating, but they experience a car accident, and it might take a good month or so before their body learns to settle down when they get into a car to drive again. Now, PTSD and complex trauma symptoms actually continue through time, and they affect the brain and physical health. The thing I want to point out, though, is that post-traumatic stress disorder responses are normal survival responses to unusual events. And sometimes trauma survivors have a real difficult time distinguishing between past dangers and real dangers in the present. And this is something that science has shown that mindfulness can help us with. So the question remains, what is mindfulness? According to the Buddha, it is a skillful action. So paying attention to the interconnectedness between the mind and body. It is something that can increase our capacity to be with things that are uncomfortable. It allows us to understand the nature of thoughts and emotions. And we all know that sometimes we respond to things emotionally that are not actually happening, but we just think that somebody might have said something to us or about us, when in fact they didn't. Mindfulness is also beneficial to helping us recognize our habit patterns and conditioned behavior. Oftentimes we are responding to events and behaviors that happened long ago, but we're getting stuck. Mindfulness can also bring us into the present moment and help bring us back into the body. Sometimes trauma survivors have a very difficult time finding safety in the body, but through mindfulness practice and yoga, we can learn to find a little bit of ease in the body. Now, trauma is an embodied experience, and it's something that mindfulness can really help illuminate. So it helps us to see when we're in what's known as the trauma vortex, when we're just getting more and more and more and more anxious about something, and our rational brain just goes offline. And so mindfulness helps us bring our rational brain, our neocortex, back online so that we can begin to see the differences between a real danger and an idea about a danger that's not actually present. So mindfulness also helps us develop inner resources that bring us back into the present moment, especially when a lot of us can get stuck in the past. And mindfulness will also help us know that our body right now is safe. Now, there are many benefits of practicing yoga as well, and I will sometime do a follow-up discussion on yoga. We don't have the time for that now, but just know in the future I will be doing something. But there are many benefits of practicing mindfulness and embodied things like yoga. And yoga is wonderful for allowing our body to switch from reactivity when it's triggered and from emotional dysregulation to homeostasis and a more skillful response. Yoga can also help us become acquainted with uncomfortable physical sensations so that we know how to be with them a little bit longer. And it diminishes our impulse to run away or push away unwanted feelings. Now, increasing our ability to distinguish between past, present, and future is also a really strong benefit of mindfulness and yoga. And the reality is, long-term meditators can hold on to pleasant experiences longer. That was a big light bulb moment for me when I recognized and learned that meditation can change and increase your ability to focus on pleasure and joy rather than on negative things. Our brains are wired many times to focus on the negative as a survival mechanism, but mindfulness allows us to hold on to the joy a little bit longer. And of course, mindfulness and yoga can help us learn how to discern between real and present danger and past events. So I want to take a moment to share a few practices for healing, and so I'm going to stop my video. So the first practice that I want to share with you today is a breathing practice that can really be done anywhere. You can do it in your car, you could do it while you're, I would say standing in line somewhere, but we're in a pandemic. So, when you're walking outside, it's something that is very portable. And it is called the 5-7-8 breathing meditation. And this is a way of focusing on our breathing to help challenge habituated reactions that we might have to things. In other words, 5-7-8 breathing is a way of learning how to kick on our parasympathetic nervous system, that part of our body, the brilliance of the body that knows how to rest and digest after a difficult experience. And so what I want to do is invite you to come into a seated posture and just relax. It doesn't need to be overly rigid. Maybe your feet will be on the floor. You can place your hands in your lap if that feels comfortable. And I'll invite you to close your eyes if that feels good, or you can take a gentle gaze, again, about a foot in front of you. So here are your instructions first. So we're going to breathe in for a count of 5. Now remember, this is not 5 seconds, but a count of 5 according to the rhythm of your own body. A lot of times people think we're counting seconds and then they run out of breath and then they get really stressed out. That's not what we're doing here. So we might breathe in for a count of 5, like 1, 2, 3, 4, 5. And then we're going to hold that breath for a count of 7. So 7, 6, 5, 4, 3, 2, 1, and then exhale to a count of 8. So you can actually silently say these numbers to yourself or envision them in your mind. So let's begin the 5, 7, 8 breathing. So breathe in for a count of 5. We're going to hold for 7. And exhale for a count of 8. Inhale for 5 counts. Hold for 7. And exhale for 8. So I want you to continue this and really focus on your own rhythm. Just remembering the 5, 7, 8 count. Let's just take a few more rounds of that 5, 7, 8 breathing. And let's do one more round. Wonderful, welcome back. So again, the 5, 7, 8 breathing is a very simple breath practice that we can bring along anywhere we go. And it really is a way of calming down our nervous system. And so I really encourage you to practice it. If you found that you were running out of breath, don't worry, that happens to everybody when they first try. You just need to continue to practice and find a rhythm and a way of counting that makes sense for your body. Each of us has a very unique body and each of us breathes in a very different way. So I want you to honor your body as you do the 5, 7, 8 breathing method and see if it works. It may or may not work. Most of the time it does. Most of my students really enjoy this practice because it does give them a sense of empowerment to be able to help tune in to their own bodies and begin to relax a little bit. This last meditation practice that I'm going to offer you is called the Compassionate Touch Meditation. And this is a meditation that can help you connect to your body in a way that is kind and caring. We need a lot of compassion, not only for others, but also for ourselves. So please sit comfortably with your eyes closed if that feels good for you and comfortable for you. And spend a few moments coming into that comfortable position, that comfortable posture. And just begin to take a few deep breaths in and out. And with your eyes gently closed, bring your attention to your hands, noticing whatever they are touching, noticing the sensation there. Imagine that your hands are beginning to fill up with kindness. However you can imagine that happening. Your hands are full of kindness, caring, and warmth. Now lift one hand and place it on the opposite arm. A gentle touch, a caring touch. Just notice what this feels like, this physical sensation of touch. And notice your reaction. Notice any thoughts that are passing through your mind. And just touching with kindness. Now, bring the other hand up and place it on the opposite arm as though you were giving yourself a hug. You might want to shift your arms up or maybe wrap them around your shoulders. A kind and gentle, caring touch. And just notice what this feels like. Noticing any reactions. Notice what's going on through your mind. Refraining from judgment. And touching with kindness. And when you're ready, go ahead and rub your hands together, creating a little bit of warmth. And when you're ready, gently cup them over your eyes, allowing the eyes to rest in this caring gesture. And when you're ready, go ahead and place your hands on your thighs, gently placing them wherever feels comfortable. Allowing your arms to rest gently. Completely allowing for tenderness to develop, and tenderness for all the feelings that this might bring up. And slowly move your hands to your abdomen. Just resting with the abdominal wall as it rises and falls with your breath. Noticing your reactions and your responses without judgment. Continuing to feel kindness from your hands. A sense of holding yourself in tenderness. And finally, place one hand or maybe both hands over your heart. Becoming aware of your breath. Feeling the caring quality of your heart. And letting that come through to your hands. Letting all thoughts come and go. Come and go. Coming back to a sense of tenderness and care. In the last moments of this process, you can rest your hands wherever they are, or if you feel that there's another part of your body that could use a tender, caring hand or touch, go ahead and move your hands there. And continue to rest with a sense of warmth for yourself. And when you're ready, gently open your eyes. Thank you. I wish that we had more time together, but I know that this is a very busy weekend for all of you. And so I really look forward to connecting with you in our question and answer session. And it has been my great honor and pleasure to be with you. Much gratitude. Thank you.